Hi everyone, and thank you for taking the time to listen to this brief presentation on a systematic review of economic evaluations of healthcare interventions for people at risk of or experiencing first episode psychosis. My name is Gemma Shields and I'm a lecturer at the University of Manchester. I'd like to thank my co-authors Linda and Debbie. The review was conducted as part of the IPAC study, which is looking at improving prediction of psychosis. And the research is funded by the NIHR, just to note that the views expressed are those of the authors and not necessarily those of the NIHR or Department of Health and Social Care. Preventing psychosis and effective treatment in first episode psychosis are key priorities in the guidelines available from the National Institute for Health and Care Excellence. Published evidence demonstrates that psychological therapies, early intervention services, and antipsychotic medications can improve symptoms, quality of life, and functioning for these patients. Our review assessed the evidence base for the cost-effectiveness of health and social care interventions for people at risk of psychosis and for first episode psychosis. Additionally, we aim to determine the robustness of the evidence base and to identify gaps. We conducted electronic searches to identify relevant economic evaluations published within the last 20 years. To meet the criteria for inclusion, studies had to report a full economic evaluation, synthesizing costs and health benefits. Additional inclusion criteria were people at risk of psychosis or experiencing first episode psychosis with no restriction by age. Screening, data extraction, and critical appraisal were performed based on pre-specified criteria and the forms based on NHS Economic Evaluation Database Handbook and the Consolidated Health Economic Evaluation Reporting Standards Checklist for economic evaluations. The protocol was registered on the Prosperia database and results were summarized in text, tables, and figures. After 2 stages of screening, 14 studies were included in the review. Generally, authors had favourable conclusions about study results, especially for early intervention programmes. Interventions are frequently noted to be cost-effective, even dominant, which is cost-saving and health-improving, versus comparators. However, the evidence base was mixed and there were limitations. Methods were not consistent across studies. A significant area of heterogeneity was the measure of health benefit used. 11 of the studies included a cost-effectiveness analysis with a variety of health benefit measures, including relapse, recovery, death, averted psychosis, years lived with disability, and symptom measures. This limits comparability between studies, and we also need to consider whether these measures of health benefits are comprehensive and include what is important to people experiencing first episode psychosis or at risk of psychosis. Half of the studies included a cost-utility analysis of quality-adjusted life years known as QALYs, and results were varied, with the incremental cost-effectiveness ratios ranging from dominant to over €400,000 per QALY gained. As well as variation in the measure of benefit, there was further heterogeneity in samples and methods. This heterogeneity across studies makes comparisons very difficult. Decision makers will need to look closely at studies to determine whether they are relevant to their setting. For example, if a comparator or standard of care reflects their own setting. There were clear gaps in the evidence base. For example, there was no evidence for low or middle income countries, and there were limitations to the review, such as the exclusion of the grey literature and non-English language studies. The review has highlighted several areas for further research, including more robust studies with a larger sample size, more investigation of the impact of patient heterogeneity, perhaps with subgroups of cost-effectiveness, longer-term evidence, and more evidence related to the population at risk and across different countries. Furthermore, if future evidence used more homogeneous methods, for example by using QALYs informed by the EQ5D, which was recommended in a publication, it would be easier to synthesize the findings and draw comparisons across the studies. If you have any questions or comments on the presentation, please add them to the comments section below the video and we will read and respond. We are finalising the draft publication and submitting it soon, so please do email me if you would like an update when a full paper is available. Thank you very much for listening.